right, so now we're on to placement of the fixed retainer. The teeth have already been conditioned, they've been pumice and etched, and now we're going to place the wire. Prior to this step, we've already measured our wire to make sure that it is the proper length. Essentially, the wire is going to extend from the middle of one canine to the middle of the other canine. So you don't need it to go all the way across the canine. You've got to have adhesive that covers it. So you got to give yourself enough room so that you can place adhesive past the wire, beyond the wire, without it getting to the marginal ridge of the distal marginal ridge of the canine. So you're going to get your cotton pickup, and this is a very important part of the step. Notice how if I lay the wire one way, it bends a little bit, but when I lay it the other way, it bends more. This is the side that you're going to place on the lingual surface of the teeth because it gives you a little more flexibility and it fits into the arch a little bit better. So, like I said, it's already been measured, so we're just going to check it and open a little bit for me. When I lay it on the teeth, you can see that, open a little bit wider for me, you can see that it extends just a little bit beyond the middle of the teeth. So I can cut it just a little bit so we can get it to perfect. We're just going to remove about 1 millimeter from one end of the wire, and then it should be good. Now the next step is to isolate the area. So we're going to get a cotton roll, and isolation, the isolation needs are different for each patient. For some patients, you only need one cotton roll in between the teeth and the lip. And if they're a pretty good patient and they keep their tongue away from the teeth, then you may not even need suction. Other people, who aren't as comfortable while you're working in their mouth, they may move their tongue around a lot, or they may have a lot of saliva that's building up. So you may need suction, and you may need an additional cotton roll between the tongue and the lingual surface of the teeth. In this case, I think we're going to be good with just one cotton roll. So, like I said, the teeth have already been etched. So we're just going to blow some air on the teeth so we can get them nice and dry. Just like when we're etching, just like when we're preparing to bond, at any other time we want to see the nice frosted surface of the teeth after drying them out. And everything looks good, so now we're going to add the bonding agent. You don't need much, and for instruction on placing the bonding agent, you can refer to the fixed retainer guide, open wide. The most important thing to know about placing the bonding agent is you do not want to allow it to extend to the gum line or into the contacts. If the bonding agent flows into those areas, then the adhesive is going to flow into those areas, and our goal is to prevent the adhesive from getting in those areas so that way the retainer is as hygienic as possible. Now, the great thing about this bonding agent is its viscosity. Because it's a little thicker, it has a little more capillary action, and it's going to allow us to lay this wire on the teeth without having to hold the wire in place. Open just a bit for me. So as you can see, I've placed the wire on the teeth, and it's stable. I don't need floss to hold it there. I don't need to hold it with my hand. Try to keep it mixed up. I don't need to hold it with my hand or anything else. The bonding agent itself is holding the wire there. Now, one thing that can be done here is you could take the light and try to cure the bonding agent and try to set the wire in place. I don't even take that step because if you're careful enough when you add the adhesive, then the wire still shouldn't move, and you should be good to go. So I usually start by fixing the canines. The order in which I place the adhesive is important because it prevents, number one, it prevents you from moving the wire, and number two, it allows you to make a nice smooth application of the adhesive. So first, we're just going to express a little bit of the adhesive out onto your glove just so that you already know that it's ready. If I had been doing this on the tooth, I'd have just been sitting there with the syringe tip next to the tooth without any adhesive coming out. So that's why we start by putting it on the glove.